So for those of you who may be joining for the first time, this is my third time to talk, and I'm going to go over some different information tonight because I definitely believe that we have not even begun our outbreak here hardly. Yes, we've had a number of people, but I expect that looking at the curves of every other city, that, based on the size, obviously we're not going to be New York City, but we're going to have a big spike for ourselves. And so what I want to remind you is that the first two of these talks have already been posted. We have a YouTube channel, which is interesting to me. I never even knew that a person could have a YouTube channel. And this is also, I think they're posting this on Facebook, and we have a blog on our computer that from now on the internet, I said our computer, but you don't have access to my computer, but at the Chinese Acupuncture Clinic internet, there's a blog, and I think a lot of things are being posted on it. So if you want to look at the things, you just have to go in and sign into our YouTube channel. I think we have 3 videos there about Qigong, and they're just small videos, and one of them is by Greg Case. And the other one is by Tyler White, who's also on the faculty. And so these are 2 men who have practiced Qigong for many years, and they have videos leading Qigong. And those 2 Qigong, both of them, are focusing on the lungs and the kidney, which are what we all need to focus on right now for our health. Now, there's also one for the children. And please know that when I did that, I did it form. I just stood up and put my iPhone up and started working, and Jennifer was there to kind of shift the phone around to follow me. But there's also one for children that I did myself. But all of those, I think, are already posted on the YouTube channel, and they're going to be posted on our website soon. At the end of this talk tonight, I'm going to put it up so you can send questions. I'm not going to do the question, have you asking questions while I'm going through this, but I'll do it right at the end. So since there are some people who haven't been here before, I just want to go through a few things that we've talked about every time. And what they're now stating is that probably 70% of us will get COVID-19. But the thing to remember is that for some of us, there'll be absolutely no symptoms. And for most all of us, it will be very mild. In other words, we might have a cough for a couple of days. We might feel like a little bit of achy. But for the great majority of us, there's going to be, very little symptomology. We're not going to get significantly ill. More than 80% of us who do get this will not require hospitalization. I know everybody's always concerned about children, and children at this point are making up less than 2.5% of all of the people who are reported cases. That 2.5%, of course, we all wish, it was not that 2.5%. We would much prefer that it be those like me who are over 60 years of age. But there are a small percentage of children who are getting ill. But the biggest thing is to know, again, that less than about 2% of the people who get this are going to pass away. And we hate that, even that small amount. but it's important to remember, because I think that right now everybody hears coronavirus, and but if you started having a cough right off the bat, that could be a little bit of hysteria of, oh, am I going to die? Okay, so let's all try and keep this in perspective, that unless we're really sick already, most of us are going to come through this pretty okay. We'll just have the flu or have the sinus infection or a cold, whatever your other symptomology are. There are a few things that I do want to say is I want to go over the difference between those symptoms that you're going to call either us or another healthcare provider, and the difference of the symptoms that we want you to immediately go to the hospital. So if you have a fever, a cough, shortness of breath, and even a temperature, those are times to really stay home and call your healthcare practitioner and either go see who that person is or come in to see us for care. These are the emergency warning signs. And I'm going to tell you that if you have these signs, don't stop to call us. Don't stop to call your primary care physician. Call an ambulance, or if you live closer to the hospital, get in a car. But I'm going to almost always suggest you call an ambulance, because when you call an ambulance, you get routed directly into the emergency room. Now, that was also before we had the coronavirus. I have heard about, ambulances being lined up outside of hospitals. But still, if you're in an ambulance, I would say if you have these severe symptoms. So the severe symptoms are, number one, trouble breathing. If you're having a difficult time breathing, and it's not just shortness of breath, but you're struggling to breathe, call an ambulance. If you have persistent, in other words, not just having a little bit of pressure in your chest or pain in your chest, because the truth is, a lot of people get a transient chest pain, which can be related to indigestion. But if you have persistent pain in your chest, or even feel like an elephant is sitting on your chest, call an ambulance. If one of your family members is very confused, or you're having a hard time arousing them in the morning or after a nap, that's a time. And the last time is, if you're looking at your partner, your housemate, or your child, and their lips are blue, or there's blue markings on their face, underneath their nose, or, oftentimes their nose or around their lips, go immediately, because, they're having enough difficulty that they're not getting good oxygen. So I'm going to repeat those: trouble breathing, persistent pain or pressure in the chest, confusion or inability to wake someone up, and bluish lips or face. Those are emergency signs. Those are the signs that you go immediately because you need help breathing, okay? If you're just having some shortness of breath, then, and you're in the kind of the respiratory infection stage of this, then, those are things that your primary care physician or we can help you with. But these other things, again, straight to the hospital. You know that our office is open. In case you do not know, we are doing telemedicine, so you can make an appointment from your home and do it over FaceTime or a Skype, or we have some set up where we can do it over the phone. Some people have asked what we're doing at our clinic. And at our clinic, we bought an industrial-sized defogger that basically is every night, it is disinfecting our office. So it's used in every room. doorknobs, faucet handles, the flush on the toilet all being disinfected every 30 minutes. I'm saying this for those of you who are practitioners out there so you can hear what we're doing. All of the medical practitioners in our office are using the N95 mask. We also have N95 masks for our assistants who are going into the rooms. All patients who enter our office are expected to wear the surgical mask at this point. So when you walk in the door, they're on a chair. We are asking you to pick one up and put it on. All of our herbal dispensary are also wearing protective equipment, and we no longer use a waiting room. You have to go directly into a treatment room. We don't let anybody sit out. It's like you walk through the door, you pick up your mask, and we're going to guide you to a treatment room. So for those of you who are, thinking about opening up your practice now, those are some of the things that we suggest. This last week, I had a number of people calling me because they were asking about whether they should be doing some detoxifying treatments. And it seems that there are people in town who are telling people that they should be doing a juicing protocol right now to basically cleanse themselves. And I'm going to kind of stand up and suggest that you not do that. Usually whenever you're doing some kind of a cleansing, most all of us have things that may be latent because, maybe we've, been drinking a lot or smoking or any number of things. But during a time like this, if you start doing a cleansing, oftentimes you're going to get some type of a response, and you might have a healing crisis. This is not the time to be going through healing crises. So I'm going to suggest that right now, everybody try to just stay as healthy as you can, and that we not look at going and doing an overall cleansing. Don't go out and do a bunch of colonics. Don't do a regime where you're basically sitting in a sauna for a couple of hours a day to sweat excessively. Those are not the things. Right now, we don't want anybody's body to be getting weak, even if it's because you're fasting, you're over cleansing. So right now is not the time for that. Right now, eat a good clean diet, okay? But it doesn't mean it's a time to fast. Right now, fasting and going without sleep, all of these things are not really useful right now. So that's one thing that I wanted to talk about. The other thing is in China, when for the last couple of months, my Chinese friends have been saying, you need to wear a mask, you need to wear a mask. And they're talking about not just when I'm in the clinic seeing patients, but they're saying all the time. And it basically took the CDC, almost 3 months to start saying everybody should be wearing masks. You shouldn't be going into a grocery store to shop without a mask. You shouldn't be any place where you're around other people. Even though at the college right now, we only have one person working in each room, we're still keeping 6 feet between us, and we're all wearing masks all day long because we're sharing the same building, even though there's 7 or 8 of us in the building, and we all have individual rooms. And I think that there are some things that the Chinese are aware of, and this is just one of them, that they already knew everyone should be wearing masks, not just physicians who are treating people. And so one of the things that you will see tonight, and I think this will have to be posted on a blog, so it'll probably be tomorrow morning, but I did a handout today on mask, because, you know, I know that we've heard that just wrapping a scarf around your face is good, but it's really not the best. It's not that hard to make a good mask that even has, you know, a shield in it to help with stronger protection. So these instructions were put together by a doctor in China, and it will be posted on our blog tomorrow. So I'm going to encourage you all to look at this and make a mask, but don't think that just a bandana or that just a scarf around your face is sufficient. I'm going to suggest that you do something a little bit better, and so we'll put these masks up. I think that we don't know the best thing here sometimes, and we haven't looked at everything, and so I really want you all to pay attention and create a mask that's better for you if you don't have one already at home. I think one of the reasons that the Chinese may be ahead of us here, and we know that how bad it was in Wuhan, and now they're starting to open up, and I have expressed already that I don't even think that we're to the max of what's going to happen here in Asheville. Part of that is because we don't have enough testing for people just to drive up and get tested at this point in our community. Once we have that, we might see how many people are walking around that don't even realize that they've already been exposed to the coronavirus. But in China, there have been over 320 large-scale epidemics in 2,000 years. So they have a 320-year history. Now, that's not to say that we don't have that same, but the difference is they have 320 years of actively working with treating it with medicine. And of course, you have to remember that in China, Chinese medicine was traditionally just medicine. That was all the medicine that existed up until the 18th century. There are a couple of different types of treatment strategies for working with epidemics. The first book that really addressed this was the Shanghan Lun, and that was written in about 206 BC. And so that's damage from code, and it has to do with also feverish diseases. There's also the Wen Yi or the Wen Bing tradition that was established by Wen Yi, and that was in 1642, and that was the treatment protocols that were basically used with SARS back in 2002 in Hong Kong. There's another basically section of the Wangdi Neijing that was written in the 1st or 2nd century AD, and that was on treatment of heat diseases. So we have all of these ways of treating epidemics that have been known in China since the 200 BCs up until the Wen Bing tradition that basically was created during the Ming Dynasty, because in the Ming Dynasty, which were the 1300s to the 1600s, there were many, many epidemics at that time. And so there was a whole new system of medicine called the Wen Bing School for treating epidemics. You should know that in China, 85% of the people who have been treated for the coronavirus have used both Western and Eastern medicines, okay? I do believe that's another reason that they may have moved past this quicker than what we may here in the United States. Those two, if we look, the heart disease, the book that was written in the 1st and 2nd century, it's called the Yellow Emperor's Inner Classic, and it's one of the classic texts of Chinese medicine, and our students still study that today. Since this happened, I've talked with my teacher, Jeffrey Ewan, and in September, he's actually going to teach a workshop for all of our students on working with the epidemics. Let's see. Besides the working with the coronavirus, I've already mentioned SARS, which was in 2002. Chinese medicine was also used for the influenza, the Spanish influenza that was in 1918. It was used for SARS and also for the avian flu. So it's been utilized for many, many years. And a member of the World Health Organization who was on a medical team during the 2002 SARS was basically pointed out that those patients who were using both Chinese and Western medicine recovered quicker. The reason I'm sharing all of this is because we don't want our patients to get to a point to where they have to be in a hospital on a ventilator. We are hoping that if someone intercedes, if someone begins to feel the first initial symptoms of a sinus infection, or you have the aches of a flu, that you immediately call your practitioner. Even if your practitioners close their office, your practitioner knows you. Look up their phone number and call them and ask them what's the best thing, because knowing your constitution, they may be the best person to be able to help you. If for some reason you can't contact your practitioner you've usually worked with, then you can call our clinic. We've opened this up tonight to not just the clinics, the patients of the Chinese Acupuncture Clinic, but also the patients of the Taoist Traditions College Clinic. If you have a formula that was from the Taoist Traditions College Clinic, you can actually call up the college and they will mix that formula and put it out on the deck. One of the things that I've recommended from the very beginning is that even if you don't see someone for an individual consultation, there's a formula called Jadescreen. And that formula is basically protecting, and it strengthens the lung qi. So what I'd like for you to do is get that from your practitioner or from another practitioner, or you can buy it from our clinic. We don't want you coming into our office. So we set that out every morning out on the porch. And if you come by, you just pay for it. We have a bucket, a basket, I'm not sure what they have, where you just drop a check in it, or if you need to pay by credit card, you call us from your car, sitting inside your car. But, I really recommend that you take Jadescreen to try and stay as healthy and to keep your lung qi as strong as possible. So we've talked a lot in the last couple of times about all of the things that are important, and we've talked about tonight how important it is to wear a mask every time you're out in public. And out in public, even with, a few people that you're working with, I really strongly suggest that you all wear a mask. But what I want to talk about tonight is, what do you do if someone in your family gets sick? Because I think in the next couple of weeks, we probably will have a lot more sick people. And I want you to make sure that you kind of know what to do. So the first thing I'm going to do is talk about what I want you to do in your home all the time, but particularly if someone gets sick. Because if someone gets sick, please remember that touching my computer with this metal cabinet it's in, the virus can survive at least 3 days on that, okay? The virus on cloth survives for 24 hours. So the first thing you have to do when I walk in the house every night, the very first thing I do is my clothes go directly to the washing machine and I take a hot shower then. This is not the time to be taking showers in the morning. Every one of us need to be taking showers at nighttime as soon as we come home right now. So if you're cleaning in your house and the first thing is I'm going to tell you, get disposable gloves, okay? You know, it's one of those things that probably about 3 months ago, I was going through some things at the Dallas Traditions College Clinic and at my own clinic, the Chinese Acupuncture Clinic, and I found thousands and thousands of gloves, and I thought, this is ridiculous. Why do we have all this? I wish I'd found hundreds of masks. We were able to get masks, but we didn't have hundreds of masks. My office never again will not have hundreds and hundreds of masks, just like we had hundreds of the gloves. So, you know, we are able to clean constantly using the gloves, and all of our assistants can have them. When you're doing that, all you need to do is basically use soap and water. If you're using the high touch, you know, surfaces, that's doorknobs, okay? For us, it's the bells in the room. It's light switches, it's the countertops, it's definitely your phones, okay? Your computer keyboards, like Rachel right now would be flipping if she knew I had her keyboard up in my hand. So when I finish here tonight, I will take the little wipes that you have, or else you take the disinfectant, squirt it on, you know, a paper towel, and you clean keyboards, you clean your phones. These tend to hold the bacteria there a long time. And we know that a lot of it is from touching those and then touching our face. The other one is the airborne. So we're wearing a mask all the time, but every time we touch something, you know, we need to stop and think, oh, wait, like right now, I won't let anybody hand me their phone and use their phone because, you know, we're all constantly on our phones and our mouths are right up there. So they're probably some of the most germ-ridden things we have. So make sure that you're cleaning all of those things with either disinfectant spray or wipe or soap and water if it's just routine surfaces. They're EPA registered household disinfectants, okay? But the other thing is you don't have to go out and use those. Just diluted household bleach will also work, okay? Usually to make a bleach solution, you can have 5 tablespoons of bleach, okay, per gallon of water. So that's about 1/3 of a cup of bleach, pouring it into a gallon of water. That basically will work just as good as a 70% alcohol solution, okay? Rubbing alcohol, hydrogen peroxide, bleach, all of these things are disinfectants, but the easiest to make is about 1/3 of a cup of bleach into a gallon of water. You know, you also have to look at laundry. If you're washing laundry for your family and you have a sick member in your family, you again need to be picking up their clothes, taking their clothes into the laundry room, wearing gloves. The minute you handle all the dirty clothes and put them in there, you want to take off those gloves. And obviously, you're not going to put it up to your mouth and pull it off, you know, take it off and drop it directly into a trash can. The dirty laundry from a person in your family can be washed with your dirty laundry also, but put the water as hot as you can, at least make it warm. And, you know, if it's something that can be, you know, if you can do it with, you know, if you can do it with hot water, do it with hot water. What you don't want to do is every time when I go to put my laundry in, I shake it just to, you know, get all the wrinkles out of it and so it's not bunched together. Do not shake the laundry at this point in time. Whatever viral you know, particles are there or just going to fly off. So no shaking the laundry, pick it up, put it in the washing machine and wash it on the warmest temperature you can. The biggest thing is if you have a patient or a family member that's sick, it's really, really important that they be in a room by themselves. Now, this is something that we knew even when we had young children in the house, because from a Chinese medicine perspective, at nighttime, the Wei Qi, and that Wei Qi is the external energy that's protecting your body from all of the bacteria and virals, pathogens. When we are sitting here and I'm in a room with 2 or 3 other people, my Wei Qi is very active. So hopefully it's like seeing these little buggeroos coming towards me and punching them back and moving them out. But at nighttime, our Wei Qi retreats inward. And so we're much more likely to get exposed to things at night. So I'm going to tell you, it's really important not to sleep with someone that's sick. That's all the time, not just during this time where we are in this epidemic, but all of the time. But that's easy to say if it's your husband or your wife or your adult partner. That's impossible if we're talking about a 3-year-old child. So, you know, and having been a parent and knowing that, you know, what I would hope is that all of us can do, you know, massage on our children, immediately wash our hands really, really good, and then sleep in the same with them, but not right in the same bed. Even make a pallet on the floor, you know, because if they're sick and they have the coronavirus, they really need to be in a separate bedroom, okay? If you have 2 bathrooms in your house, only use one for those people who are still healthy, who may not have the virus at this point. Classify one bathroom as for those people who are ill with the coronavirus. The thing to remember, here at the college now, we have a sign on the doors that it says stop. And before you leave, you're supposed to spray the handles of the toilet, the handles on the faucets, both of those, and the toilet seat with the disinfectant, and use paper towels to wipe it. And then you use that same paper towel that has the disinfectant on it for opening up the doors to go out of the bathroom and drop it. So everything in the bathroom that you could be touching really needs to be wiped down with disinfectant. And it's really, really important that if someone has the coronavirus, that they have a separate bedroom and bathroom if possible. One of the other things is we know that, you know, if you have a mask, and so maybe you're just wearing a surgical mask, but you have 3 or 4 of them, you know, let it sit for 3 days. If you have 4 masks, wear one on Monday, a separate one on Tuesday, a new one on Wednesday, a new one on Thursday, and then on Friday, you wear the one you had again on Monday. Rotate the mask, know how long they've had before you wore them, because if you let them sit there for 3 or 4 days, whatever the viral influences should die on a mask. It's not like a hard metal surface where they live longer. Up until recently, in our world as it is, it's not uncommon to grab food to go. And I know all the restaurants are really opening and selling food. And of course, we want all of those businesses to do good, but I don't want them to do good enough at my own risk. And I'm sorry, there are too many people we know who are having the coronavirus who don't have symptomology. And so, you know, I'm going to encourage you to pretty much eat at home as much as you can at this point. Um, Again, with food, if you're taking care and you're feeding someone who is sick, make sure that when you're washing their forks, their spoons, their plates, their glasses, that you're wearing gloves that you can throw away. You know, just them holding the plates right after they've eaten, they're going to have, you know, the virus is going to be there on the plates and on the forks, everything. So make sure that, you know, you're washing and carrying their dishes using gloves, disposable gloves, and wash them in hot water. And if you can, put them in a dishwasher and make sure that you're using hot water. If you have a patient who is sick, at your home and your family member who's sick, put a trash can in there, and instead of picking up that trash and taking and twisting it closed, immediately put another trash bag over it and dump it into a separate trash bag that has not been in that room. So you're double bagging it, but you're keeping hopefully whatever they've used and been throwing into trash cans if they've had a sinus infection or coughing a lot. So all of these little bitty things are so important, because we know that this virus is having a very high transmission rate from human to human. And most things don't have this high of a transmission rate, but because of the way this Corona-19 virus is working, make sure that you do all of these things in particularly if you have someone who is sick at home. The other thing is, we've sat here and we've talked about all the things that you need to do to make sure that, you know, they're in a separate room. You're not sitting there using the same TV clicker. If they're well enough to be watching TV, they're either watching something on a computer or they have their own TV. But certainly do not have them coming out into the room and sitting with you for 3 or 4 hours every night on the couch watching TV. You really have to separate out from adult sick family members. Again, it's different if it's children. But there's a couple of other things that we haven't talked about. And right now, because of this, I would assume that there's really a high amount of fear and a high amount of worry going on for everyone. So we also have to look at our emotional health. And as adults, we kind of understand what's going on. And even though it looks so bad on the TV, we realize that, you know, 98% of us who get this are going to survive. 80% of us will just stay at home and will not have to go to the hospital, okay? 8 out of 10 people will not even have to go to a hospital for any care. And that's pretty high though, which is why our hospitals are having such problems having enough personal protective equipment. So these are all things that we really want to pay attention to. But if we think about children, and they're in our house if you're listening to the news, maybe while you're fixing dinner or something, our kids don't have a filter to understand this. And so I'm going to tell you to really try, if you have TVs, to keep those off around children, because I think that we're going to have a lot of issues with children because they're out of school, they know it's serious, and you really need to sit down and reassure your child that they're okay and that mom and dad's okay, but we have to address everyone's emotional health right now. And anything that you can do to reassure your children is going to be good. And as far as all of, you know, the adults in your family, it'd be better if all of us weren't really watching the news, because it's pretty scary. It's kind of nice that I don't have a TV, but anyway, that's the biggest thing I wanted to talk about tonight, because I believe that we're going to end up having a lot more infections coming up pretty soon. I'm gonna see if I can figure out how to scroll on, because I think I've been getting some questions, and answer any questions I see. If you have questions, you should check your. Oh man, I didn't know that about smart devices or a way to hack into my computer, because I can tell you, I certainly did not ever put a Roomba on my computer so I could turn it on from home. Someone's asked about the dosage to use for jade windscreen. You have to realize, based on the manufacturer, there's a lot of different dosages. There's some where it says 10 pills 3 times a day, and there's some where it's 2 pills 3 times a day. I tell you that for me, the ones that's 10 pills 3 times a day, those are the tiny little BBs about like that. And I don't take 10 of those. I'm taking like 20 of those 3 times a day. So I'm doing a doubling amount. Closing lids to flush someone sitting in is absolutely important. If you're ever on airplanes, never ever flush those toilets without closing that lid. I fly so much that that's something I'm always doing. So someone wrote in, a husband says that if one of us is sick, we're all sick. Well, oftentimes that can be the case, that everyone in a family is sick, but that's not always true, okay? For some reason, 30% of us, though we're all being exposed, aren't going to get anything. So it's not like I'm saying that 70% of the people basically will show that they had the coronavirus, and I think at some point they'll be able to look and test for antibodies to see who had it, that they didn't have any kind of symptomology. But not everybody is sick. So if your kids are all teenagers, it'll be easy to handle. If the husband and wife are both sick, even at this point, it's up to the husband and wife to clean up behind themselves for trying and keep their teenagers. But we want to do the best we can to keep anyone from getting sick. But Catherine's got a pretty good idea that probably if one person is sick, we've seen something where whole families get this. Someone's had congestion for a year or two, almost like a chronic bronchitis with chronic cough. Does it make you more vulnerable? Probably so. I mean, if you have a problem, if you have lung congestion and you've had a chronic bronchitis for a year, then yes, your lungs are probably a little bit weaker. So I would tell you to, probably look for an acupuncture, so someone who's a strong herbalist to go and see. If you're not symptomatic, if you're not asymptomatic, astragalus does not cause high blood pressure. And if you live alone and you're not going out, what precautions should you take? Well, my mother's 90 and she does live alone. And so what we're doing every day, my sister Susan is setting up chat groups where we go on to Zoom and she gets to talk to all of our grandchildren. So the biggest thing is to make sure that you're not just feeling alone, that you're reaching out, talking to friends, and staying involved with everybody. There are 3 main herbs in the formula for Jadescreen. Now, sometimes we might put a little, some other herbs based on your constitution, but if you're asymptomatic, in other words, if you have no symptoms, yes, because Jadescreen is a tonic, okay? It's to make your lungs stronger. If your lungs are stronger, then in Chinese medicine, we know that you can fight off a respiratory virus better. So yes, reishi mushroom is also a wonderful tonic. Someone asked about that. And so I would tell you that reishi mushroom is another thing you could be taking. There's so many things you could take. It's just that Jadescreen is a formula that has been around for thousands of years and has been used in China to boost the lung qi and protect us from viruses. So yes to reishi mushroom, yes to Jadescreen. I'm not seeing any other questions. It's about 10 to 8. We have a few more minutes. If someone has a question they'd like to bring up. Oh man. The general middle of night need to make a call. Okay, I would tell you if in the, hang on, excuse me. If you're getting a sore throat, I'm going to recommend that you stop taking Jadescreen, okay? If you're getting a sore throat, I think you should be calling a practitioner and getting what's the best for you. I have recommendations about air travel. I travel constantly, and I never get on a plane that I don't take yin chow. Now, anyone who's been coming to our clinic knows what yin chow is. It's an antibacterial, antiviral herbal decoction, and it's made, the peels, 2 of the primary ingredients are in it are honeysuckle and forsythia, which grows so wild right here in Western North Carolina. So whenever I get on a plane, if it's a short flight, say I'm going from here to Shreveport, I would take 1 box, 8 pills, but I take 8 pills back. When I'm flying overseas and I'm on a plane for 13 hours, I take a minimum of 2 boxes of that, and sometimes I'll take 3, but I don't get on airplanes without taking yin chow. Let's see, can you go on? Any recommendations about air travel? You can call my clinic for a telemedicine visit, or you can check with your own personal acupuncturist. Our phone number is the Chinese Acupuncture Clinic, 258-9016. The truth is, if you need to call someone in the middle of the night, I've been telling people my phone number, because we do not want someone waiting 24 hours. If you're having health problems with this and you believe if you're having a severe cough, but yet you're still doing okay at this point, you're not blue, you're not having problems, then we do want to be called. And geez, if you call me in the middle of the night, no, it's because I think it's important. Yeah, my phone number is 273-0324. I did say that because if someone's my age, if you're 68 and you start having really a severe cough, then we need to intercede right then. We can't wait until Monday if it's Saturday morning. We've got to intercede immediately. So my phones are supposed to be monitored. And I think what I'm going to do, instead of doing what I just did, give out my number, I'm going to make sure that the phone number at nighttime gets basically forwarded to one of the doctors at my clinic, so someone's always asking it. Okay, air travel, I answered that. Oh, recommended foods again. So remember that this is a illness that basically has to do with dryness internally. So even though the body is creating phlegm, the fever usually because that dries things out. Heat dries things out. We all know this. And so I'm going to say that what we need to be doing is taking yin tonics, okay? Now, a yin tonic is something that is not going to create a lot of heat when you eat it. So it's going to be no spicy foods, okay? Nothing that is really acidic, okay? There are a lot of foods like lotus, okra, all of these a gelatinous food like okra is really a good yin tonic for the lungs. But I'm going to tell you, soups, stews, things that don't have a tremendous amount of heat to them. And I'm talking about spicy heat, not warm foods, as in you're eating a soup. I think I gave Paul a list of those foods, but maybe I didn't, but I will make sure that those get put up. Recommendations for general immune boosting herbs and foods. General immune system boosting is going to be the Jadescreen formula. Someone said, do you have Jade Serenity? Jade Serenity is not the name of a classical formula. Jade Serenity is probably Jadescreen with maybe a couple of other herbs added that are calming to the spirit, just based on that name. But Jade Serenity is not a classical formula. So I would bet, because of the word jade, got those first three herbs, astragalus, atractylodis, and Sila, in the formula with a few other herbs. So that's probably just a name that was made by some distributor. General immune boosting herbs and foods. If you are a person who tends towards anemia, then that's going to be something like a red meat. Or if you're looking at animal foods that are nourishing to the yin, that's going to be lean pork chops, and it's going to be seafood. Not so much shrimp and crabs, those that walk, but deep sea whitefish like halibut and mahi-mahi, or the shellfish that don't walk, like scallops, clams, mussels, okay? Pain. Okay, so whenever you're giving me something that's a Western tincture, unless you're giving me the botanical name, I'm not going to know what it is, because my teacher was Chinese. We learned everything in Chinese. The part of the forsythia is actually the pod that splits open when the flower comes out. If you're in somebody's acupuncture office, ask them to show you, because that's what it is. Do the Chinese expect a warm weather risk decrease? I do not know. I would think that this is not going to be something that is going to be here this year and not at all next year. I think that by next year we'll have more information and we won't be surprised. But I think that, thank you, whoever sent that in about have each doctor on call for one night. That's a good idea. But, you know, I don't think we really know what's going to happen in the fall and spring when things change. When the weather changes, there's oftentimes it's hard to make that adjustment. Xuan Fu Ha. Yes, and that's a good herb for it. I still think Jadescreen is the best. Coronavirus does not always have a lot of phlegm. Oftentimes it's going to be a dry cough. It may start with phlegm, but Emily, because of the high fever plus will make that difference. Let's see. Okay, so here's a list of foods. They just put down the foods I'd said. Pears are particularly good for the lungs. mulberries. There are things in here that I don't usually recommend because we live in such a damp climate. But right now, because this is a disease that's characterized by dryness, I'm doing more things that would be like a banana. Oftentimes we have so much phlegm in this community, but so I don't recommend bananas usually, but right now that would be a particularly good thing. I also don't recommend tofu as a rule because tofu is so hard to digest. Now, if it's tempeh, because it's is much easier to digest in that form, but I don't usually recommend tofu. You know, I don't recommend cheese if it's made from, and I don't recommend cow's milk if it is the standard stuff that we buy in Ingles grocery store because of it's not a clean food. If you have friends who have cow's milk, or if you, there are many, many people who make really good cheese here in our community, that's a different thing. And, you know, the big thing to remember, I think, for everybody is that no matter what's going on right now, we just all need to be compassionate for each other. You know, we don't need to be having road rage if somebody's passing us or doing anything else. You know, it's at this point in time, it's so stressful. So make sure that you take care of yourself, okay? And then make sure that you're taking care of all your loved ones and staying in touch. You know, if you have elderly parents or elderly friends. Now, don't all of y'all call me. I'm not elderly, even though I'm 68. I consider myself a swing chicken still. So don't all start calling to check on me. We make a Jadescreen tincture at my office. So it's, and so it's gluten-free. So I would tell you to look for a tincture rather than a pill, because oftentimes there are additives for people who may have celiac disease. Thank you so much. It's 8 o'clock. I hope you all have a wonderful night. And I'm gonna keep doing this every week because things happen, so much happens every week. What I'd like to know though is, contact us over Facebook or something, telling me any kind of thing that you'd like for me to respond to, and I will try and talk about whatever you want, whether it has to do with diet or Qigong or anything. So make sure you send those requests in, okay? Thank you again, and it was nice talking to all of you. Good night. Have a good night.